One of the things with alcohol use, that's important is we look at testing and how it impacts upon people's lives. If you're looking at a standard drink, which would be 6 ounces of wine, 1.5 ounces of hard liquor, or a 12-ounce beer, that will increase the blood alcohol level of a man by 0.02, but interestingly, a female by 0.04. The reason being that there's an enzyme in the stomach called gastric alcohol dehydrogenase that inactivates the alcohol before it's absorbed. So men have more of that. So for every drink, a woman will get more in her blood than a man will, and size does matter with alcohol consumption. And then we will metabolize one standard drink per hour. So if you had four drinks, say 0.08 over 3 hours, and just for simple math, you metabolize the 3 in 3 hours, three standard drinks are 0.02. At the end of that 3 hours, a man would be 0.02. Now, a woman at 0.04 would get up to 0.12 and then would metabolize one standard drink just like a man does. The metabolism is the same. So the woman would have 0.06. But you're seeing how alcohol gets out of the system relatively rapidly. So, that test, if you're looking for a breathalyzer or something, the next day it's going to be normal. But ETG testing is long-term alcohol. And so that's going to be around for a while. And depending on how heavy the use is, it's going to be around for longer. So, when people are being tested and they're being ETG tested, I mean, that really, we're in a problem situation to begin with. It's not a good situation if somebody has to look at the ETG test to monitor somebody. So we don't want people to try to beat the test, but this is a really important time to seek outreach and help with the problem, because if you're going to have positive tests, and some people have extraordinarily high levels, this is a cry for help. It's not an attempt to try to beat the system, and if you're trying to beat the system, it's not going to last for long.